Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
A new dementia map published by the government reveals patchy NHS care for the condition across England. While some regions appear to meet national standards in terms of offering support, the Health Secretary says other areas fall short. Jeremy Hunt said tackling the disease was a key priority, but charities said the postcode lottery of care was unacceptable. Here's our health editor, Hugh Pym.
Nance has had dementia now for about 16 years, and so she's in a quite advanced stage, but she's got incredible care by people who really care about her personally. My mum is a Dementia Friends champion. So
the actress Carey Mulligan talking there about her grandmother's experience of dementia. She joined the Health Secretary Jeremy Hunt at a photo call as she became the first UK Global Dementia Friends ambassador, encouraging volunteers to learn more about supporting people with the condition.
There are ways to live well with Alzheimer's, and so as much as there is a sort of fear to it, of course, in families, especially where it's been through several generations, there's also, we are trying to build a better society for people who do live with dementia.
But the Health Secretary says local services could do better as he launched a new dementia atlas showing how many patients had the required care review in the last year. In Somerset, for example, fewer than 50% had their care reviewed. In Newark and Sherwood it was nearly 70%, and in South Tyneside more than 80% had the review. Today's initiative also aims to promote so-called dementia-friendly communities, including Sevenoaks here in Kent. That's where local organisations work together to try to raise awareness of dementia, with schemes including one which helps older people who may be out shopping and become lost or confused. This dementia cafe in a local theatre runs twice monthly. People with dementia and their carers gather to pool information.
My mum enjoys it, so it makes it a positive experience and something for us to do together. And for my dad, it means he meets other carers and who obviously understand the situation he's in.
But local organisers acknowledge that more needs to be done nationally.
We could reach more people. We'd like to be able to reach more people with more services and more support. So, you know, maybe we only reach 1 in 10 of the total population living with dementia at the moment, and we'd like to improve on that.
Health authorities in Wales and Northern Ireland both said they were investing more in services for those affected by dementia. Scotland will announce a major new strategy later this year. Across the UK, few would disagree with the need to raise care standards and awareness of dementia. Hugh Pym, BBC News.
Time was, back in the early days of the National Health Service, that children's medicine, paediatrics, took second place to the care of adults. Quite rightly, those days have long gone. And yet, the Royal College of Paediatrics says things are now heading back towards how they once were because of a shortage of doctors and other medical staff in children's medicine. The college lays some of the blame for reaching what it calls breaking point on the new contract for junior doctors in England.
Having a child in hospital is one of the most difficult experiences imaginable. For Harrison's family, it's only the care of specialist paediatric doctors that's made it bearable. But there are no longer enough to go round.
Our services are getting increasingly more specialist as medical science advances, and there are simply not enough people in England with those skills to be able to deliver the care. So it isn't necessarily that we can't attract people to the hospital or we can't retain them, it's simply that there aren't enough in the country.
A survey of 93 children's units across the UK found that 77 aren't meeting the recommended staffing standards. Over a third report gaps in their junior doctor rotas that are having to be covered by consultants on top of their own duties. With almost 9 out of 10 clinical directors saying they're concerned about how paediatric services will cope over the next 6 months. The Department of Health says it's recruited 20,000 doctors and nurses since 2010. But there are signs the row over junior doctors' contracts could leave England hit hardest of all, as medics vote with their feet.
This year, the fill rate at ST1, the most junior entry level to paediatrics, is down to 93%. Last year, it was 97%. This year, we've seen the fill rate in Wales, Scotland and Northern Ireland be 100% for the first time in a few years, I believe.
It's not just children's services. GP and A&E posts are proving equally hard to fill, a staffing crisis that could have dire consequences.
We'll see the consolidation of some services with closures and downgradings of some A&E departments and obstetric services in some places.
How have we got here? Quite simply, the number of patients is rising faster than the supply of doctors. Emergency admissions, for example, are up almost 5% on the same time last year.
And right now, it's some of the UK's most vulnerable patients who are paying the price. Rachel Younger, News at 10 at Sheffield Children's Hospital.
I've been getting away with it all my